Hello everyone, I am Nurse Patience. Welcome to my YouTube channel. Please, if you are new to this YouTube channel, kindly hit the subscribe button, like this video, and also drop a comment on this video and other videos on this channel. So today we'll be talking about diabetes mellitus. Diabetes is a metabolic disease. If left untreated, it can cause damage to the nerves, to the eyes, to the kidney, and other vital organs in the body of that individual. Diabetes affects the way the body uses glucose, and glucose is a major fuel in the body. Glucose in the body is a major fuel for the brain. Glucose is also very important in the cells of the muscles and the tissue cells. If glucose is being affected, then the functions of the tissues, the muscles, and even the brain would also be affected. There are two major ways in which glucose gets into the cells of the body. One, it is either through the food we eat or from the liver. If you eat food, most times glucose are being extracted from such food, and excess glucose is stored in the liver, and the liver stores glucose in form of glycogen, so that in a case of starvation or fasting, for individuals that are fasting or are starving, that have gone without food for some days, what the liver does at this point is it then go back to its store and convert glycogen into glucose to help maintain the normal glucose level of that individual. The liver is very important such that it is a store for excess glucose. So an individual will not easily die of starvation. That's why it will take some days for individuals who have not had food to die, and it is all because of the work of the liver. Insulin, on the other hand, is a hormone that is produced by beta cells. This insulin, they help glucose enter into the cells. In diabetes or patients with diabetes, insulin cannot go into the cell, making individuals who have diabetes, what happen is they eat food. When they eat food, for example, the glucose, the body converts, extract glucose quite all right from their food, but this glucose cannot enter the cells. Why? Because either the insulin receptors are being blocked or they are being destroyed, as in the case of type 1 and type 2 diabetes. So individuals with diabetes, they have a lot of buildup of glucose in the bloodstream. Up next here in this video are the types of diabetes. First, we have type 1 diabetes, we have type 2 diabetes, we have gestational diabetes. So I'll be taking each and every one of them and explain it for you and what you need to know about it. I'll be very brief about it. For the type 1 diabetes, it is also known as autoimmune disease diabetes. Why? Because the cause is unknown, and what happens here is the cells of the body tend to attack beta cells, these cells that produce insulin, and destroy them, such that the insulin receptors are being destroyed and insulin cannot be produced. For individuals with type 1 diabetes, it is usually rare. For the type 2 diabetes mellitus, the individual have cellular resistance to insulin response in the body. What happens in type 2 diabetes is the pancreas, that's the beta cells, cannot make enough insulin for the body, making glucose in the body to build up, and this glucose, if they are not being utilized, it begins to cause complications for the individuals. For type 2 diabetes, the insulin is either too low or the beta cells do not produce enough, making glucose to build up in the bloodstream. Why the last type of diabetes is the gestational diabetes. We all know that during pregnancy, the placenta is being formed, and the placenta is a major connection between the mother and the baby, and it is through the placenta that the fetus gets nutrients from. And what happens is the placenta produces certain hormones that tend to affect insulin production, and if it anything that can affect insulin production or can have an effect on insulin would also affect the regulation of glucose in the body and even its metabolism, such that individuals who have this pregnancy complication of the placenta hormones being released affecting the insulin tend to come down with gestational diabetes. The next subtopic here is the general symptoms of diabetes. The general symptoms of diabetes, irrespective, these are the common symptoms you would be having. One is polyuria. By polyuria, there's increased frequency in urination. Individuals with diabetes tend to urinate more frequently than normal individuals. So it is one of the major classic signs of diabetes. Another is polydipsia. Due to excess urination or frequent urination, these individuals, their body will tend to look for way to compensate for this water loss or fluid loss from the body, making this individual to have an increased urge for thirst. So individuals with diabetes tend to have a heightened urge for water. That's polydipsia. They easily get thirsty. The next is polyphagia. Because of this extreme urine loss or fluid loss from the body, and also a compensatory mechanism of trying to get more into the body, these individuals have a heightened urge for food. They tend to crave for food more than usual, so they have a very great and large appetite, and they actually eat food well, but these food are not being absorbed. Like I told you, glucose is not being taken into the cells where they can be used due to insulin deficiency in either type of diabetes. And another one is weight loss. Individuals with diabetes tend to have weight loss due to this frequent urination, and diabetes is a metabolic disease. The reason why it causes weight loss for such an individual is the metabolic rate of these individuals increase, and there is depletion of energy stores rapidly. So these individuals tend to have weight loss. There's also fatigue for such an individual due to these other earlier mentioned symptoms. Then another one is they are more prone to yeast infection. For the female, due to frequent urination, there will be traces of glucose in the urine, because these glucose are not being absorbed into the cells. Individuals who have diabetes and are female, they usually have treatment or medications for yeast infection, because during urination some of these glucose are being excreted out via the urine, and this would create room for opportunistic infections, fungi, to grow on the genitalia of such an individual. Then the last symptom here I'll be discussing in this video is individuals with diabetes tend to have sore. Any little injury or wound that is obtained, it takes a longer time for this wound to heal. So these are the symptoms that individuals with diabetes usually present. Next here is the causes of different types of diabetes. For the type 1 diabetes, I already told you, is an autoimmune disease. So the cause of this particular one is unknown, although genetics tend to play a major role in causing the type 1 diabetes. For type 2, it is usually a combination of both genetic and the lifestyle of such an individual. Lifestyle such as obesity. Individuals who are obese and have this genetic disposition of coming down with diabetes are more prone to getting diabetes, type 2 diabetes. Then for the gestational diabetes, it is usually as a result of the hormones that are being released by the placenta. So these are the causes of this type of diabetes. The bottom line for the causes of diabetes is genetics and environmental factors tend to play a major role in causing any of this type of diabetes. Risk factors, these are factors that will predispose an individual to coming down with diabetes. First, we look at hereditary. When we talk about hereditary, we are talking about genetics. The family such an individual is coming from. If you have a family member who have diabetes, you have a more higher chance of coming down with diabetes. Age is also a factor for coming down with diabetes. Individuals that are greater than 40 years are of higher risk of coming down with diabetes. Sedentary lifestyle. Individuals who are not physically active are of higher risk of coming down with diabetes. Then the next is high cholesterol or triglyceride. Any individuals with high cholesterol level or high triglyceride, these are bad fats, and these tend to trigger the and increase the risk of these individuals coming down with diabetes. Then obesity, I already mentioned this, is a major risk factor for coming down with diabetes. The next is polycystic ovarian syndrome, can also be a risk factor and increase an individual risk of coming down with diabetes. How do you get diagnosed of diabetes? Here I will just give you very simple ways in which you can know that you are having diabetes, or somebody, you can help somebody know that they are having diabetes. First is the glycated hemoglobin. It is a test that is usually run in labs. So if you go there, you ask for HbA1c test, and you at this point a blood sample will be taken from you, and this test will be run. It doesn't take much time, but once the result is out, glycated hemoglobin test that is greater than 6.5 is suggestive of diabetes. Then a very simple one, I don't want to stress you or bore you with going to do oral glucose tolerance test. These ones are done in clinical setting, but this particular one you can do it from the comfort of your home. Blood sugar, example, using your glucometer. A glucometer is an instrument that can be used to test your blood sugar, and your readings, you can either get your reading in gram per mole, or you can get your reading in millimole per liter. So whichever one you get, if it's in the gram per mole, you are going to divide by, it will require you to divide by 18, but if it's in the millimole per liter, you don't need to divide. So if you are testing it at home, if you are doing the fasting blood sugar, which will require you to do an 8 hours of fast, 8 hours of fast or more overnight, that's from evening, you don't eat anything till the time of the test. After you are done with the test, then you can eat. For the fasting blood sugar, it is for individuals who have a fasting blood sugar of 6.5 to 8.2. This could be a sign of the pre-diabetes, and you should also follow it up and go book an appointment with a physician. Then for the random blood sugar, this one can be taken at any point of the day, provided you have eaten food. That is the random. For individuals who have diabetes, it's usually higher than 11.1 millimole per liter. So these are the records. Then the complications of diabetes. Of course, diabetes, if left untreated, have complications, and I'll just be giving you a few of them. One of the complications of diabetes is retinopathy. Retinopathy is a condition that affects the retina and can cause loss of sight. So it is very important that when you have diabetes, you follow up, you take your medications, you eat healthy. Then the next is foot damage. For individuals who have sore, those sores, usually the ones on the foot, they don't go, and it might even result to amputation of that foot or toe, which will cause damage to the individual. For the gestational type of diabetes, it causes jaundice for the newborn, and it can also cause preterm delivery for such a woman who has gestational diabetes. Another one is nephropathy. It will affect the kidneys. We all know that the nephrons are very important. They are the functional unit of the kidney, and if you have diabetes poorly controlled, it will affect the nephrons of the kidney, affecting the ultrafiltration, selection, and reabsorption of the kidney processes. So this will affect your kidney. Then another one is neuropathy. It affects the cells of the brain. So diabetes is not something you would just keep quiet and not treat it. It is very deadly. Then it can also result to heart disease. All manner of heart disease that you can think of can result to hypertension. If left untreated, it can result to other coronary artery disease. It will destroy a lot of cells in the body. These are just a little of the complications that I've mentioned in this video. There are a lot of them. It can cause a whole lot of damage. It can even result to the death of such an individual if left untreated. So for the management of diabetes generally, the medical management now, For the type 1, the mainstay treatment of type 1 diabetes is insulin, because the beta cells are being destroyed, so there's no possibility of even having some insulin being produced by the body, as these beta cells are being destroyed by the cells of the body. So insulin is the main treatment for type 1 diabetes. And this insulin can be the rapid acting insulin, it can be the short acting insulin, it can be immediate or the long term acting insulin. The long term acting insulin, example like Lantus, it can last in the bloodstream for up to 24 hours. So there are these types of insulin I've mentioned are classified according to the time they work and their onset of action. For the type 2 diabetes, it can, for some individuals, they can use both. It can be treated with a combination of insulin and oral anti-diabetic agent. So those oral anti-diabetic agents like metformin, some of these drugs can be taken orally, and they would help regularize and normalize the blood sugar of or blood glucose of such an individual. Then another treatment or management of diabetes is regular check. You need to always monitor your blood glucose so that you know what it says from time to time, so that when you see a red flag you act immediately. Then it is also important to eat healthy. You reduce the intake of carbohydrates and sweet food, and even food that contain a lot of caffeine, you try to cut them down, while focusing on food that are rich in vegetables and high in fibers. These are the kind of food you would be needing to eat when you are diabetic. Then another one is to stay physically active. You try and do exercise from time to time in the morning or evening, whichever is convenient for you, and also avoid living a sedentary lifestyle. You can also reduce the rate at which you smoke. If you are smoking and you have diabetes, you try and reduce it so that it will not trigger any form of emergencies for you. I hope this video has been helpful to you. You are yet to subscribe to this channel, kindly hit the subscribe button. Thank you.